I started GP training in my hospital RMO year and worked at Flinders, and then came out to Loxton to train because I was excited about the opportunity to be in the country. Being a rural GP to me means taking more responsibility for your patients and the care, having an understanding of the community, often knowing the patient, their family, their parents and their children, and having a role in their care. There is such a diverse range of presentations, and whenever you are managing a patient, you always think about how that might impact on their family or the rest of the community if there's someone who is quite important and has a role in caring for others. It's an extremely flexible job. I get to choose when I'm seeing patients, choose my work hours, and can rearrange around my life when needed a lot easier than I think in a bigger hospital environment. So the Loxton practice is a really friendly practice. They've always been really open to new people coming in and really friendly right from day one. They're very sociable, so it's nice to have that extra support.
We are here for them, not just here, but when they're outside the practice as well. And the community like that too.
It's also nice to be in an area where there's quite a few registrars around who've also come away from their families and their homes. We've all gotten on quite well, which is quite nice.
So I've been in Barmera for the past 6 to 7 months. I really like Riverland. It's beautiful, it does have lots of things to offer. The interesting thing about general practice is the holistic view. The variety of cases that I see is something which keeps me motivated because everything is different and every day is a learning opportunity.
I definitely think in the GP setting it's a lot easier to approach someone when you've got an issue or when you have something that you need to talk about. The supervisor's always there to talk about clinical issues or issues that you've had with patients or just any questions about even the community.
That's your advantage, I guess, of rural. You've got a long-standing team to support you through that process, and not only that, you have fantastic supervisors, and I think that is an advantage of rural, that we do have wonderful support in the practice. We're then supported by GPEx with the education and support services.
Getting new people and younger people coming in, it's really an education for me, and it's an education for the practice. They bring new ideas, some of their medical knowledge is what they see in the big hospitals, and bring it to the practice or to small country hospitals. It's valuable, and I think that's what makes my job as a supervisor very rewarding.
The registrars are here to learn, but I think we sometimes learn from them. They can help to keep us up to date with the latest and the greatest.
I've been very lucky to have a few amazing supervisors while I've been here in Barmera. That was the main reason why I've come back, because I loved working with my colleagues, still feel like I have a lot to learn from my senior colleagues, and just the collegiate atmosphere that we have here among receptionists, nurses, even patient to doctor relationships here is just irreplaceable, and I've never experienced it anywhere else. In this township of Barmera, they really appreciate what we do, so it's nice. It's a really good feeling. I guess coming out at the end of training and rethinking where I'm going to end up as a doctor and what I'm going to be doing, I couldn't imagine working anywhere else but a country setting and doing what I do here.